Hello, good morning, my dear. I'm Dr. Basma Mahmoud at Healthy Medical Student at Ahfad University, and I'll be your doctor for today. So, can I know what's your name and age, please?
Rahaf Nader, 21 years old.
Nice to meet you, Rahaf. So, Rahaf, today I have to examine your shoulders. This includes looking, feeling, moving, and doing some special tests at your upper body. Is that going to be okay with you?
Yes.
Thank you. But before I start, I have to make sure that the room is warm and there is enough privacy for the patient, and I have to make sure that I ask the patient to expose herself till the umbilicus. By looking from the front, shoulder liver is symmetrical, normal shoulder contour, no deformities, no pectoral muscle wasting, and no skin sinuses, scars, and swelling. By looking from the lateral side, normal sagittal panels, no lordosis and no kyphosis, no deltoid muscle wasting. Can you please raise your hand? No axillary lymph node swelling, and no skin sinuses, scars, and swelling. By looking from the lateral side of the other shoulder, normal sagittal panels, no lordosis and no kyphosis, no deltoid muscle wasting. Can you please raise your hand? No axillary lymph nodes enlargement, and no skin sinuses, scars, and swelling. By looking from behind, normal coronal panels and spinal curvature, no scoliosis, no muscle wasting, supraspinatus, infraspinatus, and trapezius. I have to check also for the teres minor, but it's hard to be seen. No skin sinuses, scars, and swelling. Now we're going to start feeling, so I have to wash my hands. We feel for temperature, tenderness, and masses. So now Rahaf, I'm going to start feeling. Don't worry, it's a very simple process, so I just want you to stay relaxed. Before we start, do you feel any pain?
No.
So now we're going to start checking the temperature. The temperature is normal. Now we're going to move to feel the sternoclavicular joint, the clavicle axis, the acromioclavicular joint, the coracoid process, the bicipital groove, and lastly the glenohumeral joint or the joint line. So now Rahaf, I'm going to start feeling the other side. Do you have any pain before we start?
No.
The sternoclavicular joint, the clavicle axis, the acromioclavicular joint, the coracoid process, the bicipital groove, and lastly the glenohumeral joint or the joint line. Did you feel any pain?
No.
So now Rahaf, I'm going to start feeling the lateral side. If you feel any pain, please tell me. I'm going to start feeling the deltoid muscle. Now I'm going to start feeling the axillary lymph nodes. So can you please give me your hands? The apical, the anterior, the central, the lateral, and lastly the posterior. Did you feel any pain?
No.
Okay, thank you. Now moving to the other side, I'm going to start feeling the deltoid muscle. Now I'm going to start feeling the axillary lymph nodes. So can you please give me your hands? The apical, the anterior, the central, the lateral, and lastly the posterior. Did you feel any pain?
No.
Thank you. So Rahaf, now I'm going to start feeling from behind. Do you have any pain at your back?
No.
Okay, so I'm going to start feeling the scapular spine, the supraspinous fossa, and the infraspinous fossa, the scapular borders and angles, and the trapezius muscle. So Rahaf, I'm going to do the same at the other side. Do you feel any pain?
No.
Okay. So I'm going to start feeling the scapular spine, the supraspinous fossa, and the infraspinous fossa, and the scapular borders and angles, and lastly the trapezius muscle. By feeling while looking at the patient face, normal temperature, no tenderness, no masses, and no axillary lymph nodes enlargement. Now Rahaf, please stretch your arms against the wall in front of you. No winging of the scapula. Now Rahaf, can you please copy me? Okay. This is called flexion. And then this is called extension. And then like this. This is called abduction. And then like this. And this is adduction. And like this. External rotation. Can you please turn and do like this? The other hand. And this is internal rotation. The previous one was the active movement. Now we're going to move to the passive movement. So Rauf, I need you to be relaxed, okay? Flexion. Extension. Abduction. Adduction. And lastly, external rotation and internal rotation. Now I'm going to start moving the other side. So if you feel any pain, please tell me. Okay. Flexion. Extension. Abduction. Adduction. And lastly, external rotation and internal rotation. Did you feel any pain at both sides?
No.
Okay, thank you. So by finishing the active and the passive movement, normal range of movement, I mean no any restrictions in the movement, no pain, no tenderness, and no cavitation. But before we finish, I want to show you another way to assess the internal and external rotation. Like this. This is internal rotation, and this is external rotation. So I'm going to complete my examination by examining the joint above, which is the cervical spine, and the joint below, which is the elbow joint. And then, last thing, I have to thank my patient.